Diseases like measles, polio, and diphtheria were once not eliminated, now making a troubling comeback in Malaysia. In 2018 alone, more than 2,000 measles cases were reported, and diphtheria caused fatal outbreaks in 2019. This alarming trend is largely due to the declining vaccination rates, something we all have control over. Assalamualaikum and a very good morning. My name is Noor Zahirrah binti HANIFFAH, and today I'm here to talk about why vaccination should be mandatory for Malaysians. Our decision about vaccination don't just affect us individually, but they shape the health and safety of our entire community. Making vaccination mandatory ensure we all play a part in stopping these diseases from spreading. As a biomedical student, I understand how vaccines stimulate the immune system to protect us from diseases. This knowledge allows me to confidently advocate for mandatory vaccination in Malaysia. Today, I will share 3 main points on why vaccination should be mandatory, focusing on how vaccine hesitancy increases health risks and disease resurgence, and how personal responsibility combined with mandatory law can help stop this. By the end, I would like my audience to be convinced of making vaccination mandatory in Malaysia. First, we must understand the growing problem of vaccine hesitancy. Vaccine hesitancy means people are either refusing or delaying vaccination despite its availability. This hesitation can be due to the misinformation, fear of side effects, lack of trust in healthcare, or even religious and cultural misunderstandings. According to the Code Blue 2023 report, in just 1 year, measles case rose by 63% and diphtheria by 80%. These diseases are highly infectious and they were once under control in Malaysia, yet they are now resurging. More alarming is the finding from a 2020 review in BINTI Public Health reported that vaccine refusal rate in certain regions reached up to 42.5%, and delay in vaccination was seen over 1 in 5 children. That means a significant portion of the population is unprotected or only partially protected. From here, we can see that vaccine hesitancy opens the door for disease we work so hard to eliminate, and if we don't act, more lives will be at risk. Now that we understand the problem, let's talk about the impact. What actually happens when too many people avoid vaccines? In December 2019, Malaysia saw a heartbreaking case. A 3-month-old baby in Sabah who had received some vaccines was still diagnosed with polio, a disease we hadn't seen in the country for 27 years. According to the Code Blue, the baby's case was due to the vaccine-derived poliovirus. This doesn't mean the vaccine was dangerous. It means the community where too many people are unvaccinated, even weakened virus strain from oral vaccine can circulate, mutate, and infect others, especially infants who haven't completed their immunization. This case clearly shows that partial vaccination is not enough when herd immunity is lost. Next, in 2022, during a diphtheria outbreak in Johor Bahru, 4 cases were confirmed, all involving individuals under 18 years old. 3 of the patients had incomplete vaccination records and 2 completely unvaccinated. Tragically, a 2-year-old child from a welfare home passed away from severe diphtheria while the others recovered. This highlights the importance of full vaccination coverage to protect our communities and prevent the return of the preventable diseases. After seeing the serious heart risk and even death caused by the vaccine-preventable diseases, it's clear that action must be taken. Raising awareness is important, yes, but awareness alone isn't enough anymore. When health decisions begin to harm others, stronger policies must step in. This brings us to the solution, which is mandatory vaccination laws. Let's focus on the solution of how mandatory vaccination can turn the tide in protecting our communities. One clear solution is to make vaccination mandatory. In the 2019 Euro surveillance study, Italy passed a law in 2017 requiring 10 vaccines for children. Before the law, vaccination rates were dropping and the disease outbreaks were rising. But by 2019, MMR coverage rose from 87% to over 94%, high enough to stop outbreaks. But they didn't stop there. The Italian government also ran national awareness campaign. According to the same study, this dual approach helped increase vaccine acceptance and trust. If Malaysia implements a similar strategy, a law combined with the public education, we can change the public attitudes and protect our population. People need to see vaccination not just as a personal choice, but as a social responsibility. In conclusion, we have seen why mandatory vaccination is essential. First, we have seen how vaccine hesitancy is allowing all disease to return. Second, we have seen its real-life impact, like the child who died from diphtheria. Third, we have seen how countries like Italy improve public health through mandatory laws and education. So I urge you to think about this seriously and support policies that protect not just you, but everyone around you. Vaccination is more than a medical decision. It is a promise to protect our communities together. Let's make sure this preventable disease stays in the past. Thank you.